one. Yeah.
Hi, I'm Dr. Gupta, talking about parvovirus enteritis in dogs. The disease is completely preventable with the appropriate vaccination strategy that is presented to you by your veterinarian. Ideally, puppies will be vaccinated every 4 weeks until 16 weeks of age, where they get one parvovirus vaccine at 16 weeks or at least one after 16 weeks of age. So usually our plan is to do 8 weeks, 12 weeks, and 16 weeks. And then the parvovirus vaccine is administered 1 year later, so around 1 year and 4 months. And then after that, every 3 years, because we found that titers of the parvovirus antibodies in the bloodstream of our patients getting the vaccines can be seen in most patients at least up to 3 years after the last vaccine. But once again, they need to be vaccinated once a year, twice, and then every 3 years after that. So if an adult dog is not vaccinated, I highly, highly, highly recommend that you vaccinate your dog. An adult dog is less likely to show significant signs of disease. They may have some mild GI upset, vomiting, diarrhea, or decreased appetite. However, any adult dog could potentially die from this disease if they're not cared for immediately or treated immediately, or if their immune system is compromised where their body cannot tolerate or cannot control at least a portion of it on their own. With a lot of these dogs will need to be in the hospital on IV fluids, antibiotics, and GI support for a few days, if not a week. Some cases have been in the hospital for at least a month, which is why I tell people a $20 vaccine is way more important than treating your pet for thousands of dollars in the hospital. Alright. So this is my puppy, Obi-Wan Kenobi. I suspect that all of his house or littermates also had parvovirus at the same time. He was about 2 pounds when he came in at 2 months old, and he was in the hospital for a week. After a week, took him home, and he grew up to be this big, lovable, monster-like dog of mine. So you can have successful outcomes, but it does require intensive care and intensive monitoring. And I still vaccinate him every year, and then every 3 years once he's old enough for parvovirus, because I believe it's extremely important.